Good evening, doctors. Today we are going to solve few MCQs from the very important subject of ophthalmology. So why this subject is important? This subject has about 10 questions, 10 to 12 questions in the exam, NEET PG exam, and about 18 questions in the INACT exam. So this subject is very, very important and questions are straightforward. Some of the questions are concept-based clinical case scenarios, and some questions are direct fact-based questions. If you know the facts, you can easily answer the fact-based questions. And if you are well versed with the clinical case scenarios, it will be very easy. They can ask about instruments also and a few diagnostic tests. So let us begin with the first one. Given image signifies which of the following conditions? Now, look at the picture carefully. Look at the picture carefully. What do you see here? Let us discuss it. What do you see here? They have given up four options. A. Lateral rectus paralysis. B. Internuclear ophthalmoplegia. C. Oculomotor nerve palsy. D. Trochlear nerve palsy. What do you think is the correct answer? Your time starts now. In the given picture, the patient has ptosis, ptosis in the left eye with defect in all movement except abduction of left eye. That is, there is a preserved lateral rectus function. So this suggests the oculomotor or third nerve palsy. Now, paralysis of third nerve, what happens? In complete paralysis of third nerve, there is ptosis, which prevents diplopia. On raising the lid with a finger, what will happen? The eye is seen to be deflected outwards. When you put the finger, there is eye is deflected outwards, which is known as divergent squint or exotropia, and rotated internally, that is intorted, owing to tone of unparalyzed muscles. The pupil is semi-dilated. Pupil is semi-dilated and immobile, and accommodation is paralyzed. There is a slight degree of protosis owing to loss of tone of paralyzed muscles. There is limitation of movements upwards and inwards, and to a lesser extent, downwards. With the lid raised, there is diplopia, which is crossed. Now let us look at the options. A. Lateral rectus palsy. B. Internuclear ophthalmoplegia. C. Oculomotor nerve palsy, which is the correct answer. That is the oculomotor nerve palsy. These spectacles are used in, now what you can see here. These spectacles are used in, now these spectacles are seen used in, now these spectacles, these are bifocal glasses, and most common use of bifocal glass is for presbyopes who need assistance with both close work and distant vision. A bifocal lens contains two optical corrections. The most common use of bifocal is for presbyopes who need assistance with both close work and distant vision. The upper part of lens is used to correct distant vision, while the lower half assists in with reading or other close work. Between the two parts, there is a distinctive line. Now, what is presbyopia? Presbyopia means oldie, as is a vision condition involving the loss of eye's ability to focus on close objectives. Presbyopia is a condition that occurs as a part of normal aging and is not considered to be an eye disease. Symptoms are usually noticeable by 40 to 45 and continue to develop until the process stabilizes some 10 to 20 years later. As individuals age, the lens becomes less flexible and less elastic, and the muscles become less powerful. Because these changes result in inadequate adjustment of lens of the eye for various distances, objects that are close will appear blurry. Major cause is loss of elasticity of lens of eye. Loss of ciliary muscle power, however, is also believed to contribute to the problem. Individuals typically have difficulty in reading small print and may need to hold reading materials at arm length. Symptoms include headache and eye strain when doing close work, blurry vision, and eye fatigue. Symptoms may be worse early in the morning or when individuals are fatigued. Dim lighting may also aggravate the problem. So the correct option here is B. Bifocal glasses for presbyopia. Oculomotor nerve palsy causes all A. Meiosis or dilated pupil. B. Ptosis. C. Upward rolling of pupil. Impaired, pu- impaired pupillary reflex. Now, oculomotor nerve innervates four extraocular muscles, that is, inferior rectus, medial rectus, superior and inferior oblique, in addition to levator, palpebrae, and pupillary sphincter. So, when palsy is complete, there is complete ptosis with a dilated pupil, that is mydriasis, not meiosis. Mydriasis is there, dilated pupil. The eye is deviated out laterally and usually, but not always down. The third nerve innervates the medial inferior and superior rectus and inferior oblique and levator palpebrae superioris and the iris sphincter. Total palsy of oculomotor nerve causes ptosis, results in a dilated pupil, that is mydriasis, and leaves the eye down and out because of unopposed action. Patient complains of diplopia due to paralysis of extraocular muscles. In the setting of early or partial oculomotor nerve palsy, combination of ptosis, pupil dilatation, and weakness of eye. So the correct answer here is upward outward rolling of pupil. Identify the pathology in the figure. Histopathology. Picture of retina. It is A. Drusen, B. Phagosome, C. Basal laminar deposit, D. Basal linear deposit. It is drusen. So marked pathology in the given image is drusen, which is the hallmark of age-related macular degeneration. Drusen of bruched membrane are a thickening of membrane due to dysfunction of retinal pigmental epithelium and are among the earliest findings in macula varying in size, shape, and color. Drusen need not result in visual loss, and visual impairment may occur with associated generalized granularity and or atrophy of retinal pigmental epithelium. Such granularity may occur in the absence of drusen with a similar reduction in acuity. So the correct option here is A. Drusen. What is the usual weight of rabbit used in ophthalmological experiments? The usual weight of rabbit used in ophthalmological experiments is 1.5 to 2.5 kg. Now, laboratory weight of animals: rat 180 to 200 gram, guinea pig 400 to 600 gram, mouse 20 to 25 gram, rabbit 1.5 to 2.5 kg, hamster 80 to 90 gram. Now, coming to correct answer B, 1.5 to 2.5 kg. Which ophthalmological investigation is done here? The process shown in the image is applanation tonometry using the Goldman's tonometer. The applanation tonometer is used to measure intraocular pressure. It relies on principle that for an ideal, dry, thin-walled smear, The pressure inside a sphere is proportional to force applied to surface. An appellation tonometer is more accurate than an indentation tonometer and is based on impert fixed principle. Instead of measuring the amount of indentation, the appellation tonometer assesses the amount of force needed to flatten or applanate a known area of cornea. Maximum contribution to refractive power of eye is by which part? A. Anterior surface of cornea. B. Posterior surface of cornea. C. Anterior surface of lens. D. Posterior surface of lens. Now, anterior surface of cornea. Maximum contribution to refractive power of eye is by anterior surface of cornea. The cornea's anterior surface is approximately spherical with a radius of curvature that is typically 8 mm. This surface is responsible for about two-thirds of eye refractive power. Refractive index of aqueous is 1.34. Refractive index of cornea is 1.376. Refractive index of lens is 1.39. Refractive index of lens is 1.39. Power of cornea is 43 to 45 diopter. Power of lens is 15 to 17 diopter. Power of eye is 58 to 60 diopter. Power of eye at birth is eye is hypermetropic plus 2.5 diopter. Layers of cornea: stratified squamous epithelium, Bowman's layer, substantia propria, Basement membrane readily degenerates after injury. Identify the phenomenon seen in the eye. A. Ptosis, B. Proptosis, C. Lagophthalmos, D. Entropion. It is ptosis. The following device shown in the figure is used for indirect ophthalmoscopy. What is the power of lens used to visualize the retina? It is plus 20 diopter. Interruption of optic chiasm will lead to bitemporal hemianopia. So this was all about ophthalmology. Please revise the MCQs again and again. Watch this video. Make notes as much as possible. I wish you all the best for the NEET PG exam. Wishing you all the best.